guys, this is Dr. Sunil Paudel, the world's first naturopath cum pain physician. My specialty is spine. Okay, today I am going to demonstrate a few tests that will help you to examine disc herniations in cervical and lumbosacral region. So now I am going to teach you some tests of cervical region. Okay, so one of my favorite tests is compression decompression test. Very easy. Compression. Okay, this way we put the pressure. Okay, the moment we put pressure, if there is some severe neck pain, trapezius pain, shoulder pain, or the pain radiates or the paresthesia radiates to the arms, that's a positive compression test. And now if you see that coming positive, what do? You need to do decompression test as well. So this is almost like manual traction. So my preferred way is this way. Okay, I lift the whole head up and there should be the radiation or the pain should relieve. Okay, we can do this way as well. Okay, keep both hands, grab the head from slightly behind and pull it up. So this is decompression test. If these two tests are positive, during compression that there should be pain should spread, and during decompression pain should centralize or pain should get relief. This is shoulder depression test. So what do? Okay, I push one of the shoulders down and I push the head to the opposite side. Okay, so if there is some radiculopathy or disc herniation at the neck, cervical region, or if there are some brachial plexopathy, there will be radiation or the pain increases during this test. Another of my favorite tests for cervical disc herniation is Sperling's test. So what do I do? I just press the head with extension. If there is some severe radiation that is coming from the neck and shoulders and going towards the upper limbs, that's a positive Sperling test. If this doesn't come positive, we can also do this in twisting. Okay, we can twist the head and we can do this. We can twist to the other side and still we can do this. Put a pressure and extension. Okay, the moment there is pain around the neck or that pain spreads around the shoulder and goes towards the upper limbs, there might be paresthesia as well. So that's a positive Sperling's test. So this is another of my favorite tests, Herniation test. Okay, this is also called Barber's chair phenomenon. Okay, or Barber's chair test or Herniation test. Okay, what do we ask? We ask the patient to just flex the neck. Okay, if there is some pain that radiates from the neck towards the shoulder and to upper limbs, or there is radiation or paresthesia both. Okay, tingling and numbness, all these things. If that comes positive, that's positive Hermit sign or positive Barber's chair sign. Romberg's test is another of my favorite test. Okay, so we ask the patient to be standing with legs together and we ask the patient to lift both of the hands and keep it straight. In this position, we need to ask the patient to close the eyes. Okay, and see whether the patient is swaying or is about to fall. If the patient is about to fall or is swaying with eyes closed, that tells us the disease around the cervical spine. Then we also need to find out other diseases, because this balance and coordination disorders could be because of the cerebellar origin or also because of the vestibular origin. If there is swaying with the eyes open in Romberg's test, that means the balance disorder, the cause of the balance disorder is either in the vestibular region or in the cerebellar region. Okay, eyes closed, that means cervical. Eyes open and positive means either vestibular or cerebellar. Very easy test. So this is Hoffmans test. What do? I hold the middle finger. Okay, now flex it a bit and flick the nail with my nails. Okay, this is negative Hoffmans test because there is no movement in between the thumb and index finger. That's negative Hoffman. Okay, in positive Hoffman, let's see how does the positive Hoffman look like. So you see, this is a positive Hoffman. Okay, the moment I flick the nail with my nail, if there is a flexion, okay, if both of the fingers come together, that's a positive Hoffman. A positive Hoffman's test tells us the pathology, the lesion might be in the cervical region, could be severe cord compression, could be multiple sclerosis, could be cervical myelopathy, could be thyroid disorders as well. Another of my favorite test is slump test. This is also called sitting SLR. Okay. So what we ask the patient to just raise one of the legs. Okay. The moment knee is extended, if there is pain around back or if there is radiation, that's positive sitting SLR. This is also called slump test. So what do we do? When the patient is extending, ask the patient to slump the head. Okay? The moment when the head is slumped and we slightly passively lift the leg, there should be either shooting pain or severe pain at the back. That's a positive slump test. Okay? The moment knee is flexed and head is extended, the pain should go down or pain should disappear. That's a positive slump test. Excellent to define disc disease or disc herniation at the lumbosacral region. During screening tests, we need to ask the patient to flex the knee. Okay? The moment there is pain during flexion or knee to chest, that means there might be the disc herniation might be slightly lateral. Okay? This is also called foraminal stenosis or foraminal disc herniations as well. If there is pain while lifting, while doing salivation or single leg salivation or while in reverse SLR, that means the disc herniation might be posterocentral. That's called spinal stenosis. So these are very easy screening tests. Never fail. SLR test. Straight leg raise test. This is also called Lessegu's test. Okay. So what do? We can identify lumbar disc problems out of this test. Okay. So we ask patient to slightly lift the leg, then passively we need to lift. Okay. If the test come positive before 35 degree, that means the patient is having severe disc prolapse. Okay. From 35 degree to 70 degree, if it is positive, the disc prolapse might be, the disc herniation might be slightly of lesser extent and it might be migrating slightly laterally. Okay. And if the test is positive above 70 degree, that means it is either the problem of the bones or the muscles. Okay. So this is called Lessegu's sign or SLR positive. Okay. So again, let me repeat. Up to 35, up to 70 and beyond 70. Up to 35 will be severe disc herniation, up to 70 will be minor disc herniation, and beyond that will be either of hip joint or problems related with bone or the muscles. So in SLR test, there the positive sign will be either there will be severe radiation, okay, or there will be muscle cramping, or there will be severe pain in gluteal or lower back region. So that's how we find out it's positive. Sometimes the hamstrings are too tight and there will be false positive sign. So we need to ask whether you are feeling some stretching kind of pain or real radiation. We always need to make sure. And there are a few modifications, few variations of this test. One is called bowstring test. In this test, wherever if there is no pain or something, you can press at the popliteal fossa. The moment you press at the popliteal fossa, if the radiation starts, that's a positive bowstring test. That also might tell us there might be some kind of sciatic pain going on. Okay, that also might tell us there might be some radiculopathy, some disc prolapse, or the spinal nerves are impinged. So that's a positive bowstring test, pressing behind the popliteal fossa. Okay, there is another sign, that's what we call Braggart sign. So in this position, ask the patient to dorsiflex. Okay, we can do it actively or passively. If there is radiation or severe pain at the back, that means it is positive. that also suggests disc herniation. And in this position, we can ask the patient to lift the head. Okay, so this way. If this becomes positive again, that's called Neris sign, positive Neris sign. Okay, Neris sign also tells disc disease, disc prolapse, disc herniation. So these three are modifications of straight leg raise test: Neris sign, Braggart sign, and bowstring test. Many a times my colleagues and my juniors make tons of mistake. They do SLR test actively. So actively, this is a passive test. Okay, so we need to help the patient, not patient doing it actively. That's one mistake. Another mistake, most of the people now have started walking or running. Because of that, the hamstring is always tight, and the moment you raise the leg, they feel some pain over here. That's because of the tight hamstring, not positive SLR test. Okay, we need to ask the patient whether you feel real radiation below the knee or it's just stretching and tightness. Okay, so and there will be resistance. Okay, the moment you start raising, there will be some resistance because of the tightness at the hamstrings. That you need to elicit out. That's not a positive SLR test. Okay. Another of my favorite tests, this is called Kernick's test or Brudzinski's test. Okay, so what do? We flex the hip to 90 degrees, not more than 90 degrees, and we flex the knee to 90 degrees. And we ask the patient to interlock the fingers and keep behind the neck. So what we ask the patient to just raise the head. Okay, if there is radiation and severe back pain, that means there is some disc disease, disc herniations going on over there. That's positive Kernick sign. Okay, the moment the hip is flexed more and knee is, the head is raised, if there is pain over here, that's positive. If the pain goes towards the leg, that's also positive. Disc disease, disc herniation at the lower back. Okay, the moment knee is flexed more and pain goes away, that means another positive. Okay, so this is positive Kernick sign or Brudzinski's sign. Now I am showing you the FAIR test. This is one of my favorite tests. This helps me to elicit hip problems, acetabular problems, and deep gluteal syndrome. What is deep gluteal syndrome? Earlier people used to tell Piriformis syndrome, but there are other things associated over there. In gluteal area, there are piriformis area, there is sciatic nerve over there. Okay, there are gluteal muscles. So all these structures might give rise to pain or sciatic kind of pain. Okay, so there might be space occupying lesions also. Okay, it could be because of the trauma as well. So all these things are because of all these complications. Nowadays Piriformis syndrome is not used, so more preferred term is deep gluteal syndrome. There might be anything, we don't know. We may have to do other radiological tests to elicit that. So FAIR test is one of my favorite to rule out what you call Piriformis syndrome, what I call deep gluteal syndrome. So what I do, flexion of the hip, flexion of the knee, that's F. A means adduction. Okay, IR is internal rotation. So what I do, I lift the ankle up to 45 degree so that internally rotates the hip. Okay, so this is called FAIR test. The moment if there is pain from here, the moment I internally rotate the hip, the moment there is pain in the gluteal area, that is positive FAIR test. That also says something about hip joint and deep gluteal syndrome. So another test to find out deep gluteal syndrome, including Piriformis syndrome. Okay, sometimes the piriformis muscle or the gluteal area, there might be some lesions that gives rise to sciatic kind of pain. So this is to rule that out. So what do? This is also called clamp test. So what we ask the patient to lift the knee up and we press it from above the knee. Okay, if there is some pain in this test around the gluteal area, that's positive clamp or positive active piriformis test. Okay, this test tells us about the deep gluteal syndrome, including Piriformis syndrome. So we press it over here and ask the patient to lift. Favor's test is another of my favorite tests to rule out problems in sacroiliac joint or into the hip joint. Sometimes it comes false positive during the disc diseases also. So what do? We take one of the leg, okay, and keep the ankle above the opposite knee, and we press from the knee. If there is pain around the hip joint, that's positive Piriformis test, and that tells about the hip pathology or the muscles around hip. If there is pain around the lower back, around SI joint, sacroiliac joint, that's a positive sacroiliitis. Okay? So sometimes in disc diseases, there will be muscle spasm in this area. So that also will lead to false positive tests. So we need to be aware of that as well. So now I am showing you femoral stress test. Okay? So what do? We ask the patient to basically lift the leg up. Okay? This can be done passively or actively, both ways. So now I am asking her to do actively. So this is also called reverse SLR. Okay? Reverse straight leg raise test. So if there is pain over here around the lower back, or if there is radiation, that's a positive test, and that tells us that there might be posterocentral disc herniations, or there might be central canal stenosis, what we call spinal canal stenosis as well. Okay? So I am going to do it passively as well. So what do? I take it this way, flex it, and keep one hand below the knee and lift it up. Okay? So if there is shooting pain or severe back pain or shooting pain or the radiation, that means that's positive reverse SLR or positive femoral stress test. Okay? So positive femoral nerve stress test tells us the lesion might be around L2 to L4, L2, L3 and L4. Femoral nerve stress test will come positive. These cervical and lumbosacral physical examinations, physical tests are very precise. You can do it in any kind of setting. Okay? Before writing an X-ray or an MRI, you need to have a thorough history taking and physical examinations. I take tons of webinars every month. Our webinars are voted one of the best if it comes to spinal diagnosis and management. So if you'd like to learn more about spinal diagnosis and management, kindly WhatsApp me. Okay? We also teach you spinal X-rays, reading and interpreting spinal X-rays, spinal MRIs, CT scan, chest X-rays, and tons of other things as well. So kindly be in contact, kindly be in touch. Till then, ciao, bye-bye.